There has been a sea of change in the management of breast cancer and also the diagnostic tests. As a medical oncologist, I will focus more on the personalization of systemic therapies. But let's start with the area of early stage breast cancer and new data on gene profiling. This has been a big advance because we now have a reliable trial that tells us the outcomes of patients based on gene profiling with the 21 gene recurrence score, that now for 1 to 3 positive nodes, that the Oncotype DX score is useful in making decisions in this group of patients, particularly in postmenopausal patients. We can now spare chemotherapy for patients with 1 to 3 nodes that have lower scores. And this is really a new change. This wasn't the case in premenopausal patients, but you're going to hear much more about the perspectives from different users of these tests and what it means in real life treatment. In the area of genomics for advanced breast cancer, likewise, we are seeing many new drugs being developed that are based on the results of this assay. You will hear about HER2 mutations, for example, and how we treat those and where the field is going. What should we know about genomic testing in general, how to order it, how to interpret it, how to make decisions, and how to screen for clinical trials. You're going to hear about new classes of drugs altogether. Selective estrogen receptor downregulators, as an example, has now been shown to be more effective than its predecessor therapies for hormone receptor positive cancer that is pre-treated. And you're going to see much more about how this is now going to be integrated into practice. This drug is not yet approved yet, the one in particular that was tested, but you're going to hear the opinions of different leaders, as well as members of our audience commenting on this. Speaking of hormone receptor positive cancers, we have revolutionized how we're treating these in the advanced setting now with more information of cyclin-dependent kinase inhibitors, which are now a standard part of the landscape. But you're going to learn more about the granularity as to how to make decisions in distinct patient populations based on gene expression profiling, as well as other clinical characteristics, and similarly for the use of PI3 kinase inhibitors in this disease. In the area of HER2 positive cancer, we have seen the most dramatic results from a randomized trial comparing what used to be the best second-line therapy, T-DM1, to a new antibody drug conjugate known as trastuzumab deruxtecan, showing almost a 4-fold improvement in progression-free survival, something we have not seen before. So this is really going to turn things upside down in the HER2 positive world. But at the same time, there are new medications that are entering clinical trials as well that will continue to change things in that area. In triple negative breast cancers, the world of immunotherapy continues to change and evolve as we now, for the first time, have a recent approval of immunotherapy for early stage breast cancer in the neoadjuvant setting. So you're going to hear from the experts who have been involved in these trials as to how to interpret the data, how to use it in real life practice, how to incorporate it into special populations of patients. So this is just a taste of what you will see. We're also going to cover some of the more human sides of treating patients, such as how to understand their side effects, both their physical ones and their emotional ones, how to deal with unique populations such as older patients or patients who may be pregnant. And we want to focus really on individualizing therapy, not only for the common classifications of our patients, but really for special and unique groups as well. You're going to hear about supportive care. How do we deal with patient side effects of therapies? How do we get them through some of the more difficult treatments? And then finally, you're going to hear about controversial areas with our very well-known Crossfire series, looking at whether immunotherapy should be used in patients with complete pathologic responses, and several other complicated and controversial areas that you will see in a very friendly yet competitive debate environment. So overall, we're going to have not only the new developments, but how to apply them in specific cases with the tumor board setup series that's going to delve into some of these areas where there are many different treatment options. You can hear the pros and cons from the experts, as well as from fellows and audience members who present the cases. So altogether, it's going to be an entertaining and fun way to learn and to take what you gather from the meeting and apply it on Monday morning in your practice.